Thank you very much. Ladies and gentlemen, good morning, and thank you for the introduction. Thank you very much to Chris Rex for your words earlier, Chris, and thank you to Michael Roth also. We have developed, I think, over the years an excellent working relationship, and I look forward very much to that continuing. Thank you for meeting in my hometown of Brisbane. Unfortunately, I've got a race from here to the airport to get back in time for question time, one of the joys of life in government. And it's really great to be here, and I acknowledge the people today that have been pioneers in creating a sector that has played a pivotal role in building the Australian health system, and those that continue the legacy today. In the pace of today's global economy, that work continues to grow in importance, and private hospitals in this country are, as most Australians know, world leaders. So it is a pleasure to be here and to officially open the third National Congress. So the sector makes a major contribution to the contribution of the health and wellbeing of this country, providing Australians with more choice in the type of healthcare that they can access, whilst at the same time taking pressure off the public system, particularly public hospitals and emergency care. Our world-class health system is as good as it is because it relies on a combination of private and public services. And like business, government can no longer just rely on increased funding for increased patient outcomes. We need to be stripping costs, regulatory burden and bureaucratic nonsense from the process. We want to ensure patient safety, and government can do that by helping to reduce the red tape industry that has been created in your sector under the guise of workplace health and safety, duplicative reporting requirements and the like. In a mature and professional model, it is a distraction from the core business of patient outcomes. Dramatic improvements in productivity gains in the public sector are also essential, just as they have been in the success of your business model. Importantly, they create a competitive tension, resulting in better patient outcomes and greater efficiency in the spend of your tax dollars. Our bureaucrats in Canberra understand that definite change of direction under this government, and our role across the department is to facilitate, not frustrate, the efficient delivery of health services. I believe significant productivity gains in healthcare can and must come, not only through improved public sector efficiency, but also through bold new ideas from the private sector. The private sector generally has a key role to play to ensure the required productivity gains are realised, including through expanded services, innovation, technology and training. And I'm pleased that we're already moving in this space. Earlier this year, I opened the Uniting Care Clinical School at the Wesley Hospital here in Brisbane. The expansion of this school will allow an additional 270 students per year to develop their clinical skills through on-the-job training in a fully equipped clinical environment. Indeed, across Queensland, in another private setting, the Icon Cancer Centre is now treating over 70,000 patients per year. 20 years ago, public officials would have scoffed at suggestions that these services could be delivered outside the public setting. I'm also encouraged to see that health insurers are looking at innovative options in the area of primary health care. Now, there's been some recent media interest in this particular issue, and I wanted to take the opportunity today to deviate just briefly to address what is a very important matter. Around 11 million Australians have some form of private health insurance in this country. So it seems sensible to me, and it should seem sensible, I think, to all Australians, that insurers would want to do all they could to help keep those customers healthy and to avoid admissions, readmissions and procedures if clinically appropriate to do so. They have been excluded from the primary care space for historical reasons, and if insurers are prepared to work collaboratively with doctors and patients, then we should welcome that development. Sharing information about the patient with all the usual safeguards has the potential to free up capacity for non-insured patients, not detract from it. And so that makes it no different than the approach that we take to the rest of the system. Indeed, this measure strengthens Medicare, it doesn't weaken it. The collaboration between Medibank Private and the Independent Practitioners Network in the Northern Brisbane region is one such example. HCF is providing an after-hours home GP service for their members. In addition, Bupa and Healthscope have entered an arrangement where Bupa members can use the Healthscope national network of medical centres, skin clinics and pathology services. I do, though, want to address some comments as they were recently reported on this issue. My support in this area is around trying to provide more support at a primary care level. That is in the patient's best interest and ultimately that of the Australian taxpayer. If an insurer can provide additional support to the doctor around interventions to, say, a pre-diabetic patient, why would we resist that? It has the potential to save a lot in human and financial terms. However, it does not and will not involve that person opting out of the Medicare system, and therefore debunks any suggestion that this will undermine Medicare. As I say, quite the opposite. From an insurer's point of view, it allows them to target the frequent users, and if implemented correctly, it will be a longer run save to the insurer and ultimately policyholders. We have no interest in supporting changes that would result in higher premiums and therefore bring pressure to bear in other parts of the network. And our support of these trials is predicated on that assumption. I should also note, with a word of caution, the payment arrangements as have been proposed in some of these future design proposals. I would find it very difficult to see any system changes in this space where insurers were picking up out-of-pocket expenses for patients, that is, delivering free services. This can be about value adding for insurers, that's fine, but it is a byproduct. My main objective is to help people improve their health and, where possible, enhance the primary care offering so as to avoid those future interventions. We're willing to provide some support through Medicare, but not beyond that. So it's essential that we continue to explore new and innovative ways to provide healthcare in this country. But it's incumbent on all of us as taxpayers, as managers of the health system, as users of the health system, and most importantly, as deliverers of the health system, to make sure we deliver services in the most efficient way possible. This is particularly the case given the Australian government spending on healthcare has more than doubled in the past decade alone. The discussion now must be about sustainability. The $62 billion the government currently spends each year on health will blow out another $13 billion over the next 4 years. As a nation, we're spending around $120 a week on healthcare for each man, woman and child. And over the past decade, Commonwealth Government spending on public hospitals is up 83% and is projected to rise by another 50% over the next 4 years alone. And that's why we have started a discussion about the type of health system that our nation needs to go forward with an ageing population and with the advent of many expensive medical technologies and costs beyond that. We need to make sure, as I say, that all aspects of our healthcare system remain strong and yet flexible enough to deal with future challenges, some of which are not so far off into the future. Of course, the challenges of obesity, diabetes, Alzheimer's, cancer are with us now, with rates of diabetes up by 40% in the last 20 years and Alzheimer's up by a staggering 170%. What is also increasing is the progressively personalised approach to managing chronic diseases. Future healthcare will increasingly be about personalised medicines for particular strains of cancer, or genomic testing, showing a predisposition to breast cancer or Alzheimer's, etc. And rightly, of course, patients will demand early medical intervention, knowing the outcome of that testing. Now, these are all costs which are not presently factored into any forward estimates projections, and we don't know how much they're going to add to the future health bill. But Australians will and should expect timely access to these new approaches to patient care. So it's important that we have a sustainable system which can embrace these new technologies. The private sector has the runs on the board in terms of innovation and efficiency, and the previous government seemed to look upon the provision of any medical services in the private sector as an affront to human decency. But it defied the history even of their own party. During the 1990s, there was considerable growth in the private hospital sector. This included an increase in the diversity and complexity of services offered within the sector. Now, these things that were once considered outside the realm of private hospital responsibility have grown and persisted, and many private hospitals are continuing to develop specialty care options within their facilities. Nowadays, of course, as you're well aware, there are around 1,345 hospitals in our country. Almost 600 of these are private hospitals and private day surgeries. Private hospitals are already undertaking many complex patient procedures. Indeed, all Australians should know that private hospitals provide 97% of the total procedures and treatments offered in public hospitals, including cardiac surgery. And as you would be aware, in 2012, almost 77% of knee replacements were undertaken in private hospital. But the point here is that the Australian public needs to know more about what it is that you're doing. In 2010-11, private hospitals delivered about 1.6 million non-admitted patient services, including in the areas of dialysis, radiology, psychiatric, dental and allied health services, and other community health and non-medical type services. Private hospitals also provided, of course, the bulk of in-hospital chemotherapy and the bulk of hospital care for our veterans, as well as playing a significant role in obstetric and palliative care arrangements. So why should we see private sector involvement in public services as a bad thing? Well, here in Queensland and indeed across the country, public and private hospitals are partnering to reduce waiting lists for people currently on elective waiting lists or hidden lists. In 2012-13, the Queensland Government Surgery Connect program, targeting high demand surgical specialties such as orthopaedics, urology, endoscopy and ophthalmology, saw more than 3,800 procedures supported. The Queensland Government is expecting to provide an extra 8,000 procedures over 4 years through this type of partnership, and this should just be early days. Collaborative programs such as these support innovation, help reduce cost and keep the patient at the centre of the healthcare model. We should be leveraging with the private sector, not just for services and infrastructure, but to meet other challenges, as we say, around workforce, training and the use of medical technology. It's likely that things such as robotic surgery, telemedicine and remote monitoring will change the delivery of healthcare and will contribute to improved patient outcomes, but they come at a cost. And I believe most Australians are willing to contribute to that cost. Australians expect world-class healthcare and we are willing to pay for it. But to build a health system that is sustainable, the Coalition is interested in policies which offer longer-term system reform, making smarter use of funds to provide better care. The universal health system means that there will always be value in leveraging people into supporting their own health needs in the private sector. Picking up nearly 100 cents in every dollar in delivering services in a public setting for patients makes no sense for the taxpayer when that particular patient is prepared to contribute to their own costs. Therefore, I believe one important job of the Abbott government is to grow the opportunity for Australians to contribute to their own healthcare needs. We need to look at aligning incentives and systems to make value for money choices, the easiest choices. The focus of the Commonwealth should be on getting our primary care response right, particularly for those with chronic diseases and the aged. We need to look at the payment models and the way in which we manage the most frequent users. And as I've said many times before, we need to look at increasingly moving from managing supply as measured by the volume of services provided to managing demand as measured by improved health outcomes. This is particularly the case in Indigenous communities. At the same time, we will ensure that those who are least able to look after themselves will in fact be looked after. This always has and always will be at the core of any Liberal government approach. I believe there is a capacity to use private hospitals better to improve patient outcomes. We need to look at roles for you that aren't just about service delivery. As important as that is, you can also play an important role in meeting other challenges, including supporting an appropriately trained and located health workforce, improving patient safety and quality, and delivering the best outcomes for patients. The other important opportunity is in the area of medical research. Medical research was one of Tony Abbott's greatest strengths as Health Minister in this country. I intend for the same outcome during my time in this portfolio. We currently provide $850 million a year in funding for NHMRC grants. In February, we announced $133 million in funding to support 153 grants across 5 NHMRC schemes. The grants will address broad areas of research, from infections to cancer patients to building immunity to childhood eczema and allergies, and they include postgraduate scholarships and a targeted call for research on fetal alcohol spectrum disorder. The funding announcements follow the almost $600 million for new medical research discoveries I announced in October last year. The last Coalition government increased funding to the NHMRC fivefold, from $131 million in 95-6 to $715 million in 2010-11, and all our funding commitments have been implemented. As Health Minister, Tony Abbott announced an additional $905 million for Australian health and medical research in 2006, and in 2007 he provided $485 million in infrastructure grants to a wide range of medical research institutes. The point is that I believe there will be increasing opportunities in the years ahead for stronger collaborations between world-class private hospitals in Australia and the research community, and I think they are exciting times. In closing, just let me say a couple of words about the economic legacy or mess that we've inherited. We are 6 months into government, so very much in the opening days of this term of government, and already we've been able to correct some of the difficulties that we inherited, particularly around chemotherapy, around training and in some other areas, but with a lot of work to do. I believe the future for your sector, but for the way in which we deliver health services in a sustainable way, is very bright. I look forward to continuing to build the relationship with the sector. I believe that the private sector in this country, and in particular private hospitals, are held near and dear to all Australians, and the Australian government believes very strongly that we will continue to build those relationships for the betterment of all Australians. Thank you very much.
Thank you. Thank you so much, Minister. I think you'll all agree with me. This particular portfolio, I'm just going to stand here so that people can see you. This particular portfolio has always been such a challenging one, and I think perhaps more so now with the changing complexion of healthcare and some of those challenges you spoke about. The Minister's kindly said he will take questions from the floor. Now is your chance. So if you have ever wanted to ask the Minister of Health a question, now's your opportunity. So if you would like to ask a question, if you could just raise your hand, and there's roving microphones. Oops, pardon me. I might kick off myself and ask you, Minister, you were talking about the future of healthcare with this growing recognition of we can now recognise predisposition of various illnesses and diseases. It's really in the future going to change the way we have to plan our healthcare, knowing things are coming, as you say, people wanting to deal with it with early intervention. So what are some of the strategies that the government is looking at to deal with that problem, which is very much on its way?
Well, already, if we look at the personalised medicine space and challenges for government there around populations, which traditionally would have been much larger and therefore easier for costs to be amortised, if you like, across a broader population group, particularly where significant investment had been made into technology and research. So the ways in which we provide support around funding arrangements, around PBOC, around PBS into the years will have to be structured in such a way that we can build on the success that we've been able to deal with and deliver through that side of it with medicines. And increasingly that'll be the same with, in my judgment, with genomics, because as costs continue to come down and we have a greater understanding of what that mapping will look like and mean for people and for generations of people, it will require a different response. And I think, as I say, the private sector is integral in the way in which we deliver that response, and government will have to be nimble, probably in a way that it hasn't been necessarily in some areas in the past. So at the moment, though, it's a task of greater awareness of some of the problems that we face, and I think we're starting to see a change in population attitudes around particular disease groups in relation to diabetes, for argument's sake, or obesity. 2 out of 3 Australians are overweight or obese. We have one of the highest rates in the world, and I spoke before about the dramatic increase in the number of diabetics and pre-diabetics, and we'll continue to see difficulties in that space ahead. So they're all issues that we need to grapple with, but I think we can do it more effectively if we work with and not against all of those players within the sector.
Anyone? Yes, we have a question. One down here and one up there. Down here with Chris.
Thanks, Peter. Couldn't let you go without asking a question. I was pleased to hear in your presentation about your firm view that not only Australians should, but can and even aspire to contribute towards their healthcare outside through the taxpayer base. One of the things that we've been talking about earlier here is to look at ways of coming to you with ideas to grow participation in health insurance substantially from its current 47%. Is that part of your overall view as to how we might start to reduce the burden on the tax base and indeed create much greater awareness and participation in the private sector?
The short answer is yes. I mean, if you go back to 2007, when frankly, the credit of the former Prime Minister, Mr Rudd, the work that was commissioned with Christine Bennett, but the discussion publicly otherwise, I mean, raised expectation exponentially. People heard the message that state government budgets were going to be consumed by the spend on health out by 2020, and change needed to take place. And clearly, those issues which weren't addressed in the intervening period have only compounded and remain with us today. So I think Labor was honest, at least in 2007, about the need to have a mature and responsible discussion and debate publicly about how and who and for what people should be paying. And that means that we should be chasing the most efficient spend of our dollar. And my judgment is that we leverage well off the investment that we make through the pillars of support for private health insurance. The Rudd work, of course, suggested that there should be a move to a model essentially of insurance by a number of providers across society. We haven't formed a view that that's an appropriate step for the federal government to make. But nonetheless, we should extend coverage if we can, and we'll provide support to the sector or to other parts of the health system to deliver the most efficient spend that we possibly can have in what will be a very difficult fiscal environment for whoever governs over the course of the next decade. 2.5 million people over the age of 65 10 years ago, 4.5 million over the age of 65 in 10 years' time. With all of the expense that comes with all of the medical technology and, as I say, the personalised medicines and the rest of it, we should be looking at ways in which we can continue the relationship, grow the relationship, and I think that will be to, as I say, the betterment of Australian society, but certainly the health system.
Thank you, Minister. And I think we have a question up the top.
Yeah, thanks, Minister. It's Michael Greco, Chief Executive of Patient Opinion Australia. Thanks for your words this morning. One of the things you said was that you wanted to keep patients at the centre of healthcare. What's the government's vision for ensuring that the patient voice is central to safety and quality?
Michael, you could have said anything and you didn't need to identify yourself. I can't see you up there. You could have made a much more controversial intervention. Look, we have, I mean, in a couple of ways, but just let me answer it this way. I mean, the availability of information and what you see taking place in private hospitals, not just across our country, but in other parts of the world, including in the United States, where I think the sharing of information is impressive in some of the models that are there. We don't want to adopt and will not adopt certain features of the US model, and I don't think any Australian government will. I think we have a lot to be proud of in this country, but the sharing of that information, the availability of that information and the veracity of that information is particularly important. And we commissioned a report into e-health, which was ably led by the gentleman down the front here, Richard Royal, who's known to many of you, but also on that committee we had Steve Hamilton, we had the Chief Information Officer from Australia Post, and I wanted it to be a short, sharp look at the way in which we could have an effective electronic health system, and it operates already within parts of the private sector very effectively. And if we can do that, I think we have a great capacity then to empower patients through the proper use of that information. And I think that brings pressure to bear, not just on clinicians, but on providers within the system otherwise. And I don't think we should be afraid of the value of that information. As I say, with all of the usual privacy and safeguards that need to be in place. But already in Australia, across some of the hospital networks that you administer or are involved in, we're seeing world-class rollout of these sorts of information systems. And frankly, within the public setting and within general practice, we haven't seen that uptake, despite good intent, I think, from the previous government. We just haven't been able to get the critical mass that we needed a bit around electronic health, around the e-health record or delivery of electronic health systems within this space. So I think there's a lot for us to do, and I think that is one of the ways in which we can provide further empowerment to patients, and we take it very seriously.
Thank you so much, Minister. Well, from question time at the APAH 33rd National Congress, I think you're now off to go to the real question time.
I said third, I should have said
Oh,
third.
33rd, that's all right. Please join with me in thanking the Minister. Great talk, and we do appreciate your time.
Thank you.
Thank you so much.